Hello, beautiful moms. Welcome back to my channel, Motherhood Nutrition. How can I induce labor myself? Let's begin the list with exercise. Exercise can be anything that gets the heart rate up, such as a long walk. According to a 2022 study, walking for 30 minutes 3 times a week at 4 kilometers km or 2.5 miles m per hour, starting from week 38 of pregnancy, can help induce labor. It may also help reduce interventions during vaginal delivery. Try curb walking for at least a third of your daily walk. Curb walking may encourage the baby to move deeper into the pelvis, providing relief from common pregnancy discomforts and promoting sex, though research hasn't found evidence that having sex actually results in the start of labor. Theoretically, there are multiple reasons why having sex could induce labor. For example, sexual activity, especially having an orgasm, can release oxytocin, which may help jumpstart uterine contractions. Also, for pregnant women who have sex with men, there are prostaglandin hormones in semen that might help ripen the cervix. Nipple stimulation. Stimulating your nipples can cause your uterus to contract and may bring about labor. Nipple stimulation stimulate oxytocin production. Oxytocin is the hormone that causes the uterus to contract and the breast to eject milk. You or your partner may manually stimulate your nipples, or you can try using a breast pump. Research shows that breast stimulation can be an effective way to induce contractions. Acupuncture. Acupuncture has been used for thousands of years. Even though the exact way that acupuncture works is unclear, according to research, the main benefit of acupuncture is increased cervical ripening. That said, acupuncture should be administered only by a licensed acupuncturist. Acupressure. Before applying acupressure to yourself, make sure you get proper instruction from a trained acupressure professional. If acupressure doesn't get your labor going, it can still be an excellent way to alleviate pain and discomfort during labor. Eating dates. Research shows that eating dates in the final weeks of pregnancy 1. Increases cervical ripening and cervical dilation at the start of labor, and 2. Decreases the need for Pitocin use during labor. Perks of waiting for labor to start on its own. Most pregnant women at 40 weeks are likely ready to have their babies out of their bellies as soon as possible and in their arms. I know I was ready at week 38. However, there are plenty of perks to waiting until your body naturally decides to go into labor, including recovery. Pregnant women who weren't induced typically recover more quickly than those who were. More time in the womb can mean both you and your new baby get to go home from the hospital sooner. Infants who are born after a full-term pregnancy also experience other benefits. More time in the womb typically means improved breathing, as infants born even as little as 2 weeks early can experience twice the number of complications. Better feeding once born. And increased brain development, with the brain growing a third of its size between weeks 35 and 40. Let your body do the work for a few more days, and take the time to get as much rest as you possibly can. I know that's easier said than done when you're 9 months pregnant. In my case, I had to wait until week 42, and believe me, it felt like an eternity. You and your baby will need all your energy soon enough. What is the quickest way to induce labor? If you want to induce labor fast, you need to have it done medically in the hospital. Natural remedies may be able to help, but they're not a guarantee. If you've consulted with your doctor and determined that there is a medical reason for a hospital induction, then methods they might use include giving you medications like Pitocin or rupturing your amniotic sac. What triggers natural labor? While various external factors could contribute to triggering natural labor, experts believe the body follows a complex internal mechanism that triggers the uterus to begin contractions. Before trying anything that might induce labor, speak with your healthcare professional to go over any risks or possible complications. Though some of these methods are popular folklore among pregnant people, little scientific evidence supports their efficacy. In most cases, it's best to let the baby set their birth date, even if it means waiting another week or two. Don't forget to like, comment, share, and subscribe. Thank you so much for watching.